At least a total of 85,335 children under the age of 5 were expected to receive essential anti-malarial medicines in 5 selected districts of the Bono East region. These anti-malarial medicines, typically distributed in high malaria season months of July, August, September and October in the northern regions, are for the first time being administered in the Bono East region. Today, some staff of the Regional Health Directorate, together with the head of programs at the National Malaria Control Program, embarked on a trip to some rural communities in the Sene East district to monitor how the medicines are being administered in the area. Regional Director of Health Services, Dr. Fred Admako-Boatin, noted that data available to the Directorate reveals that malaria contributes to over 25% of hospital admissions in the region.
If you look at our figures for Bono East, and then you look at the proportion of cases that come to our OPD, you can see that for almost every 100 cases that come to our OPD, 1/4, 25% is malaria. So you can see the burden. And especially when you even look at the causes of admission in our facilities, the leading cause of admission in our facility is severe malaria. And then if you look at the data, almost all the cases are children under 5 years.
He says the exercise is important to the region's fight against malaria, adding that enough support needs to be given to the volunteers for the implementation of the exercise.
These are some of the things, the reasons why we came here, to actually assess and even the routine services that they are doing, so that we can also have an idea of the services, the volunteers, the work, massive work that they are doing. You could attest to the fact that it's easy for people to say, give it to the child, but you look at the processes for one child to receive the medicine, you see that it's not a joke. It's very laborious and intensive. So all these things, when I'm able to picture this, it will inform the way that we budget for all these things.
Head of programs at the National Malaria Control Program, Dr. Kezia Mam, expressed satisfaction at the fact that these medicines are being administered and children in these areas are still sleeping under the long-lasting insecticide-treated nets.
So for us, we are happy that we are able to get these drugs to the children, because it reduces malaria considerably. That means they don't have to fall sick from malaria. The mothers don't have to take them to the hospital. I was also happy to see that the mosquito nets are being used. All the children, the parents that we asked, their children are sleeping in the mosquito nets. So it's also heartwarming. You know, sometimes when you sit and you are doing a budget and you are trying to find these resources, you need to see it being used to motivate you to even do more. So we are hopeful that all these efforts will lead to reduction in malaria cases in the country.
Some of the parents whose children are beneficiaries to this exercise expressed gratitude and are hopeful that their children will be protected against malaria. From Lala in the Kajiji district of the Bono East region, my name is Anna Sabit reporting for Joy News.